The Ebola outbreak reached another grim milestone today. 4,000 people have now died in West Africa. Our Mike Armstrong spoke with a Canadian doctor who has just returned from the front lines. And he says Ebola can be stopped in Africa, but only if the rest of the world redoubles its efforts.
When I arrived in Foya, for example.
In spite of everything he's been through and all that he's seen, Dr. François Lamontagne is optimistic. Just back from 3 weeks in Liberia treating Ebola patients, he's seen firsthand how the illness is ripping through parts of West Africa. It was his second trip this year. But Lamontagne says if Ebola does make it to Canada, this country could cope.
It's certainly a contagious disease, and you don't want to, treat it lightly, but it's not that contagious.
Lamontagne says Canadian healthcare could treat patients with Ebola. What kills people is dehydration from diarrhea and vomiting. Treat that early enough, he says, and most get better on their own.
It's not rocket science, right? If you replace the fluids that they lose, you help them.
Now, nerves are frayed around the world. In Spain today, a protest outside a hospital where a nursing assistant is being treated for Ebola. She contracted it treating a missionary who'd worked in West Africa. The Spanish Prime Minister visited the hospital today, trying to reassure the public. He says the risk the disease will spread in the future is very low and that it's important to convey that message to the Spanish people. In Amsterdam today, a cargo aircraft set off for Sierra Leone, loaded with 100 tons of emergency aid. In West Africa, the help is desperately needed. The head of one NGO working on the crisis said this week the region is at a tipping point. Ebola is either contained or it will spread out of control. The region needs healthcare professionals, doctors and nurses, and supplies desperately. The United Nations Special Envoy for Ebola today said the number of cases in West Africa is doubling every 3 to 4 weeks. The international response, he says, has to be about 20 times bigger than it is now. Lamontagne saw that need and struggled with it for weeks.
There's not a day that we didn't say, we would be able to, with just really simple things, we'd be able to help these people far better, right?
The stuff that you take for granted here.
Oh, yeah.
Lamontagne says if the outbreak in West Africa has been so hard to contain, it says less about Ebola than it does about the vulnerability of the communities it's hit. Mike Armstrong, Global News, Sherbrooke, Quebec.